I've got apologies from her. Okay. Right. So good afternoon, everybody. This is the first ever joint communities and adult social care and health OSC at Warwickshire County Council. As obviously we've never had one before, we need a chair for the meeting. So are there any nominations for chair, please?
Yes, I nominate Councillor Golby.
Right, thank you, Councillor Redford. Are there any seconders for that, please? I think Councillor. Yeah, I think Councillor Young, Councillor Kirk.
You're muted.
Right, I'll take that as a seconder, Councillor.
Yes, I am seconding. I'm sorry. I couldn't find the button.
That's fine. Right, thanks very much. Are there any other nominations?
No, Pam.
Okay. Right. Are there any objections or abstentions to Councillor Golby becoming chair of the meeting? No. Okay. Right. Councillor Golby, you've been elected chair of the meeting, so over to you, please.
Thank you very much. Okay, so I'll just do a quick introduction and welcome to everybody. We've got quite a lot of people on this meeting, and we've also got quite a lot of people who have said they're going to tune in and watch the live stream as well. So just to kind of recap on what the meeting is about, it's come about following a motion that was passed at full council, at Warwickshire County Council, full council, September 2020 that was. And the meeting is basically as a result of the resolution that was put forward at full council and agreed. So another thing that we need to be mindful of, because we have got a lot of people on, can you make sure your microphones and your cameras are switched off unless you are speaking? And this has to go for everybody because we do have issues with bandwidth. If you've got any questions, can you raise your hand, and I will check when hands have been raised whether they are historic or new, and I will also ask as well if anybody's got any questions rather than relying on hands, because they have proved to be a little bit unreliable in the past. So don't worry, I will get to you if you've got any questions. You can also put things in the chat if you want as well. We'll pick up the chat. I think Isabel, you're going to be monitoring the chat, aren't you? Yeah, so that's fine. So just as a bit of an overview of how the meeting's going to run, we've got a lot of information to get through, so we need to keep it tight on the timings to make sure everybody gets through what they need to get through. What I will ask for is, we've got several different presentations to go ahead. Even though we're all discussing a broad overview topic, we've got several different presentations. So the presentation will be given, and then I'll allow 10 minutes for questions after each presentation, and then we'll move on to the next presentation. We should get through everything. There will be time at the end to pick up anything that we haven't picked up throughout the course of the presentation and questions. So if you don't get your questions answered within the 10-minute allotted time, I will try and get to you at the end, but we do, like I say, we do need to run quite a tight time scale on this because we've got a lot to get through. That being said, can I ask that we also stick to the subject matter? We need to make sure that we are discussing meeting the needs of the Black and ethnic minority and Asian communities within Warwickshire. So anything outside of that scope is probably not going to be fit for this meeting. Can we all bear that in mind, please? And, you know, brevity is your friend on this. So that being said, I will get through and hand over to Isabel for the apologies, if you won't mind.
Thank you, Chair. Received apologies from Councillors Andrew Wright, Dave Shelton, Jeff Clark and Sally Bragg. Also received apologies from Dr. Sade Bula, and from Public Health, Catherine Shuttleworth has been substituted by Aoife Barra. Councillor Kate Rolfe will be attending late, but she will be attending the meeting.
Thanks, Isabel.
Detected in the front yard.
Silence. Can everybody silence their phones, please, and not make the mistake that I've just done? So we've had the apologies. Have we got any disclosures of pecuniary or non-pecuniary interests other than what we've got listed that we need to be made aware of? I'm not seeing any hands go up, so I'm taking that as a no. Next thing, public speaking. Chair's announcements on public speaking. Well, I haven't got any announcements as chair, and I've not been made aware of anybody that needs to be engaged in public speaking. So I will move on to actually handing over to Mark Ryder to introduce the first part of our meeting. Is Mark there? I can't see him on my screen.
Yes, thank you, Chair. I'm here.
All right, thanks, Mark. Are you all right to pick up now?
Absolutely. Yeah, fine. And good afternoon, everybody. Good afternoon, members and colleagues and guests of the meeting as well. Isabel, can I ask you screen share the slide deck now, please? On the
Yeah, I believe Paul Spencer will be sharing.
Oh, Paul. Sorry. Yeah. Thank you, Paul. There we go. So we've done the intro. So we've moved the slides on, please. And I'll just try and what I will do in a few minutes is just describe the purpose and the framework for today's meeting and introduce speakers under the various themes. So if we can move the slides on, please. Okay, so we've heard from our chair. As I say, I'll do a few minutes on the session purpose and approach, and then we're going to break into 4 presentations for which there'll be time for questions after each, covering thematic areas for EDI, education, health, economy and skills, and county council and staff. And as our chair said, there'll be time for questions after each of those. And then we're going to move on to more about what comes next. What are the next steps? How do we make this happen? And I'll bring in other colleagues, including colleague directors and others who want to contribute to that. So there'll be plenty of time for a two-way dialogue. It won't be all about presentation. So if you could move the slides on 1, please. Okay, so the session purpose, really, this came as a result of a full council decision to update on activity being undertaken by the council to support the needs of our BAME communities and staff. So it's a clear decision to bring this to this joint ONS committee. Reflecting the cross-cutting nature of public sector equality duty, this has really been a team effort. And all strategic directors, myself included, and key service area leads have worked together to prepare the update that you're going to see today. So a real team effort, and you'll hear contributions from around the organisation. In terms of how we make this work today, the way we're looking at this is in 3 sort of distinct sections. Firstly, to actually make sense is the first one, and this will give members an opportunity to consider the current position of EDI and intelligence under the themes of education, health, economy and organisation. Secondly, to make it relevant. So in other words, to be updated on all the latest activity in Warwickshire, to give it that real up-to-date and Warwickshire context. And the third section, which will come after the initial presentations, is all about making it happen. And of course, the most important step in shaping the future direction for the activity. And of course, that's the time when individuals, members will have the opportunity to contribute in shaping that. So I'll start off with a little bit of context if we move to the next slide. So to start with, in terms of the demographic breakdown, and really important for us to understand this demographic mix within our communities. And I'm not going to read that out. Everyone can see it on the screen in terms of what the mix is. Okay. In that, younger. Sorry, if you go back to the previous slide. Yeah, I mean, a couple of things to draw out here. Younger age groups have a much higher percentage of ethnic minorities within that group, indicating a real change in demography over time. And of course, our policies, our working needs to really be adapted to that and recognising that fact. I mean, what has been really been brought into sharp focus over the last 9 months at least, or probably more, in these really complex and difficult times, and the challenges that are arising from a number of issues that we face is some of this inequality. And I point here to Brexit, EU exit and transition, to the COVID response and the impact of COVID on different parts of our communities, really exposing pre-existing inequalities and a growing need within BAME communities in terms of access to our services and as well as future opportunities. And of course, the emerging national agenda on levelling up is all part of that context. Thank you. Okay, in terms of where this is rooted from a county council perspective, we do have a county council equality, diversity and inclusion action plan that was agreed in August 2020, and a vision that really sort of sits on top of that. And that is that Warwickshire County Council is a place where everyone feels valued, included, safe, supported and welcome. And this really places our approach to inclusivity at the heart of everything we do. But I suppose, that a vision is words, and I think, we can all sign up to the words that are contained there. But more than being a vision that gets dusty on a shelf or collects virtual dust on a website, this is about turning it into something that drives action as a catalyst for things, for improvement and change. And really, today is really a fundamental part of that, in hearing views and making decisions about next steps. In terms of how the vision, our Equalities and Diversity Inclusion Action Plan, affects different component parts of the County Council and the wider Warwickshire, there's sort of three things I'll draw attention to here, and they're on the screen. In that it's within our employees cohort, the thousands of people that work for us, that they are valued, they're included, they're safe, supported and welcome. And whatever their background, they have the opportunity to reach their full potential. And we'll be hearing more about through that lens later on when we talk about our organisation in one of the presentations. Furthermore, it's about communities, and that they too feel safe and supported, and that when they have contact with Warwickshire, whether as service users or customers and residents, council taxpayers, in whatever capacity, they consistently receive dedicated, inclusive and accessible service, again, whatever their background. And for you on the call as our elected members, it's really important that you're included and supported by this action plan, that your leverage and your support, where possible, will enhance our external reputation and internal profile. Incredibly important that if we're going to walk the walk on this agenda, then our leadership, our elected members, our community representatives are really signed into it. Okay, I want to go take us back, Paul, if I may, just to the initial slide, which talks about the next presentations, because that's the one. Okay, so I think we're going to start off with health, and we're going to hear from Gordana on that, and then there'll be time for questions, and we'll move on through the other sort of thematics as we go. There's 4 of them all together. So I'm going to be quiet now, and I'm going to welcome Gordana for the first presentation. Thank you.
Thank you very much, Mark, and thank you for shuffling down to slide number 6, which is the beginning of my presentation. My name is Dr. Gordana Đurić. I'm a consultant in public health, Warwickshire County Council. So obviously the health equalities are part of the big, and addressing health inequalities are a big part of public health work. Addressing the needs of BAME community in the context of COVID is a very important and obvious way to talk about and to do reduction of health inequalities. Slide 7, please. So if you look into the evidence base, and if you look at what the information up to date is telling us about epidemiology of COVID in BAME communities, we know that BAME communities have experienced significant health inequalities in relation to COVID-19. Public Health England report highlighted this inequality and has identified several main points. We know that people from Black and ethnic groups were most likely to be diagnosed with COVID-19. Death rates from COVID-19 were highest among people of Black and Asian ethnic groups. This is the opposite of mortality rates in previous years. People of Bangladeshi ethnicity had around twice the risk of death than people of white British ethnicity. People of Chinese, Indian, Pakistani, other Asian, Caribbean and other Black ethnicity had between 10 and 50% higher risk of death compared to white British. Of course, it's important to put this into a bigger picture and into context, and to realize that this analysis did not account for the effect of occupation, morbidity, comorbidity, or obesity, which we know are all factors that play into the outcomes once a person is infected with COVID-19. These are important factors because they are associated with the risk of acquiring COVID-19, the risk of dying, or both. Other evidence has shown that when comorbidities are included, the difference in risk of death among hospitalized patients is greatly reduced. So comorbidities are important. The report made 7 recommendations for implementation, including support community participatory research to understand the wider determinants of COVID-19 in BAME communities, and to develop readily implementable and scalable programs to reduce risk and improve health outcomes. So we said that comorbidities here are important, and we also said that people from Black ethnic groups were most likely to be diagnosed with COVID-19. Okay, so if we move to next slide, please. In October, the ONS, the Office of National Statistics, has conducted further analysis, which included looking at whether pre-existing health conditions could explain the differences between ethnicities. This analysis found, when adjusting for age, rates of death involving COVID-19 remain greater for most ethnic minority groups, and most notably so for people of Black African, Black Caribbean, Bangladeshi and Pakistani ethnic background. So when we kind of account for the effect of age, still the mortality and morbidity is higher. Statistical modeling shows that a large proportion of the difference in the risk of COVID-19 mortality between ethnic groups can be explained by demographic, geographical and socio-economic factors, such as where you live or the occupation. So we are talking about wider determinants of health. It has also found that although specific pre-existing conditions place people at greater risk of COVID-19 mortality generally, it does not explain the remaining ethnic background differences in mortality. So yes, comorbidity is very important. However, there are still the remaining background differences in mortality, and we need to understand this better. Next slide, please. So, just to say what the Public Health Department, together with our partners, is doing to address this. We are putting together a bid within the recovery plan. As you may know, the recovery plan, as a part of the County Council COVID-19 recovery plan, one of the following actions is included. That is Action 113, implement the recommendations from the Public Health England review of the impact of COVID-19 on Black, Asian and minority ethnic communities. So 400k bid has been submitted to the Council Sustaining Prevention Investment Fund to deliver this recovery plan objective through a project which aims to work with BAME community in Warwickshire to mitigate the elevated risk of COVID-19 mortality and morbidity experienced by this community. Obviously, this is a huge task. How we structure it and how we evaluate it is very important to show that it is having an impact, because the issue is very complex. The bid itself and the project itself has two main objectives. Commissioning of a collaborative research project to understand the wider determinants of COVID-19 in BAME communities in Warwickshire, which, if you remember seeing the previous slide, is one of the recommendations of the PHE report, to involve the communities to see and understand better the underlying issues that are contributing to increased mortality and morbidity. Once this is done, and that should not last long, we are planning to do this within the next 4 to 6 months, is to run a grants process for BAME communities to access funding for projects that link to the findings of the research. So, i.e., we will help to address health and social inequalities, particularly in relation to COVID-19. The proposed project would be carried out in partnership between Warwickshire County Council Public Health, County Council Communities and Localities teams, and the BAME partnership. So this is my bit, and I think Mark said that we can take questions now or at the end.
Thanks. Yeah, I'd look to take questions from members as we're going along from each section. So I'll just ask if there are any members with questions. I've still got a hand up from Keith, Councillor Condacourt, and I don't actually see anybody else. So, Councillor Condacourt, would you like to ask your question, please?
Thank you very much, Chair. Physical activity is quite important, and in all the groups I'm in, the walking, the cycling, the park runs, the BME community doesn't seem to be involved very heavily in those. I don't know if there's much research about physical activity and the BME community in terms of how we get them involved, either in things like park run and activities that are already existing, or whether new ways of getting them fitter and healthier, and particularly links in with body mass. I've seen the body mass indexes and things are quite key to survivability for COVID. And I know you've done some stuff, or not you personally, but research in looking at comorbidities of the different populations, but I wondered how much fitness was a part of it. Thank you.
I think that this is one of the most important issues, and I think, Keith, you have just pointed in one of the most important directions. As I said, this issue is, and the problem is, quite complex, and the comorbidities like obesity, diabetes, cancer, other comorbidities are partially dependent, obviously, on the physical activity. How one actually motivates and changes behavior so that the population that needs to be more involved in physical activity actually takes it up is very complex. I think that part of this project would actually aim to identify, ask people in local communities, what is it that they would actually like. We know that, for example, we were discussing this in the team, and there was a project, there was evaluation of I think there was a housing estate somewhere in England with lots of new bicycle lines, and the great investment, into it. The majority of people in that housing new complex were the BAME minorities, but they actually did not take up cycling. So all that infrastructure was there, but access is obviously much more than availability of means. And there is something about asking what would be the best way to get this. I know that there were some groups that were organizing dancing classes for certain subgroups of the BAME communities, etc. But to try to find out what is it and what kind of intervention is it that they would like to help in addressing something like this is the first purpose of this part of the project. I hope that this answers to some extent your question.
Yeah, thank you.
Thanks. I've got another hand from Les, Councillor Caborn.
Les, you're on mute,
Are
maybe.
you there?
Right, just got on the work we did on the year of wellbeing, where I know in some of the projects we got quite a few of the younger people in the BAME communities out. Is this a generation issue we've got to face?
It is, and I think that is part of it. However, if we are talking about COVID, we know that risk groups are higher, age, and I think it is generational. I think one of the good things that is currently happening in our population pyramid is the fact that we have much more younger people in the BAME community. So I think that as the time is passing by, access to exercise and physical activity is not going to be such an issue. But in the meantime, we still have to work with all the substrata of the population.
Okay, so we need to engage the youth to help us with the older generation as part of it. Okay.
Part of that is going to be, I'm sure, something like that.
Thank you.
Thanks, Les. Now, I'm not seeing any further hands raised. If anybody wants to ask a question and they can't raise a hand, would like to ask it now? No, I'm not seeing anything. So I'd like to say thank you, Dr. Jurek, and I'll move on to the next section if that's
pleasure. Thank you.
Happy. So over to Ian.
Okay, good afternoon, everybody. Thank you for making the time for the discussions we're having this afternoon, because it's so important to our communities. So this next few slides are going to be around what we know and what we should be looking for in terms of education equality practice. So we move to the next slide. Okay. I've put 4 slides together. 2 are data slides and 2 are interpreting the data. So we'll go with interpreting the data first. And, our education settings are very diverse and increasingly over the years are autonomous. So in various governance arrangements, it's very important that the governance asks the right questions about how the setting is performing. So if we think of schools as an example, you would expect the governing body, the local governing body in the academy trust, or the governing body in a maintained school, to have regular reports from the school leadership around how that school is supporting its community, so supporting the staff and learners and families, and actually the outcomes that are being achieved by children and young people in those education settings. So examples of how you might measure that, there is a health warning. Examples that you may have would be around learner outcomes at different key stages, examination outcomes, broken down cohort by cohort, including those for different BA, ME characteristics. There's always a health warning because the cohort may be very small under those headings. So the important thing to know is that child or young person achieving their potential? Are they achieving in line with what they are capable of achieving and what tracking shows that they should be achieving? Of course, if tracking shows that they're behind what we would say is their potential, the leadership team working with their colleagues within the school should be making appropriate interventions to get that child or young person back on track. Okay, there are health indicators for any education setting as well. for staffing. And you could do that in a variety of different ways, everything from attendance to pay models. And good relationship information does include regular reporting in terms of curriculum content and practice. So moving to the next slide then. Okay, here's where we are into the data slides. Until 2020, education was a very data-rich environment. And I think it still is more so at individual settings from early years to schools to further education, higher education. It's just conscious decisions were made at national level that the information wouldn't be published and used to judge how well settings were performing in comparison to other settings. So when it comes to some of our usual data sets, we are in an unusual situation in 2020. Our normal data set is on this slide and the following slide, but if we were trying to compare 2019, which is the last year you'll see on the columns here, to 2020, it's like comparing apples and oranges, particularly if you think of the GCSE outcomes in the summer of 2020 being based on teacher assessments with what on the face of it is a significant leap in outcomes compared to previous years in many schools. If we say 19 to 20 is like apples and oranges, 20 to 21 is going to be like comparing oranges and pears, because the expected assessment examinations in the summer of 21 are not going to be like teacher assessments in 20, and indeed they're not going to be the same as the GCSE methodology in previous years. So in short, any of these years of data do raise questions, questions that are important, but they always come back to cohort by cohort, setting by setting. Are those children and young people achieving what their potential is? So the data will not be providing linear answers for us, but it can help us whether we're looking at across the whole system or whether we're looking at individual settings as a governor or somebody who is a sponsor or proprietor in those settings. Are we collectively in each setting doing the thing that we should be and getting the outcomes for those children and young people? So just moving over to the next slide quickly. So in any of the data, as you've seen on the previous slide, some of those cohorts can vary in terms of their outcomes in any given year. And some of those cohorts, that's particularly the case when it's a small cohort. But if you look at it and you look at individual setting level, there'll be different answers that are required, COVID not being an excuse, as to how we level up and get every child and young person and every cohort achieving their potential. Which is where we then bridge over to the next slide, which is all about the current situation and our live offer. In terms of COVID response, it's been important to minimise the gap in education for children and young people. That's required some very careful and thoughtful work in terms of the safety of staff and the safety of children and young people returning to education after that gap back in the spring and the summer. And that's a general approach in terms of the advice on risk assessments and action plans, so as education settings can operate as safely as possible during the coronavirus situation. And there's advice in there around how to respond and stay operational safely, even when there is an outbreak in the individual setting. And many of you will know that involves very rapid identification, self-isolation, staffing, and for learners when they need to go and self-isolate. But that's general across all education settings. But within the guidance, we very early on were welcoming and learning the insights from the BAME community, and very specifically the advice and guidance from BAM Ed, a sector representative body, on how best to identify risk and mitigate it for colleagues who their risk is higher because of their BAME characteristics. Okay, so that's overarching COVID response, but there is also a link from there to the targeted work that we do with vulnerable children and young people, those that in a number of instances have a number of protector characteristics when we think of equalities, diversity and inclusion issues. If a child or young person is identified as vulnerable, both education settings and the local authority have worked really hard to maintain contact with them all the way through that spring and summer period. And then it also links into COVID recovery, where each education setting has been working with those vulnerable children and young people to assess what their gap has been in learning, so curriculum related gaps, and also what they have missed in terms of social skills and experiences. So every education setting is charged with having a recovery plan that works for those vulnerable children and young people. Inevitably, where we were focused on narrowing the gap before COVID, the gap widened, and we have a solemn duty here and a responsibility across all education settings for that gap to be narrowed. That can involve learning interventions. It can involve, with the national scheme and resources devolved directly from central government to schools, coaching and mentoring schemes, as well as curriculum content. To augment that national programme, locally we're mobilising the Warwickshire Challenge for Key Stage 3. Which is a set of opportunities on the social skills and learning skills side that we would expect any young person to have been able to experience, so as they're able to then also focus and benefit from their curriculum opportunities. You'll know that academies are responsible for the design of their own curriculum. And for maintained schools, although that's mostly primary in the Warwickshire context, there is a national curriculum in play. But to augment that on responding to racism and to augment the practice that is expected to be in place in every education setting, that any racist incident is investigated and addressed. We, with Warwickshire's faith groups, and with Coventry Diocese, worked on a new curriculum resource called Responding to Racism. And if you haven't seen it, more than happy to see copies of it circulated, because it is a really insightful, people speaking from their own experiences, curriculum tool around confronting racial injustice and approaching Black voices and Black history sensitively and thoughtfully as a curriculum resource. So there's a lot in there, a lot of work in progress, and happy to take any questions.
Thanks, Ian. I'm not actually seeing any hands up at the moment, but there was a question put in the chat by Councillor Adkins. Let me just find it again. She's having problems with the internet. She says she wants to ask a question. How can we improve our communications with families from BAME communities? For example, peoples whose first language is not English. this relates to communications from county generally, but perhaps specifically in relation to schools. So can you take that question on?
Okay, again, because it's a diverse sector across education settings from early years through to higher education, and even within schools, there are relatively few schools, and as of the new year, only one in the secondary sector where they are maintained schools. Every academy chain and academy has to fulfill the responsibilities in its own way, but to a sensible and reasonable standard. So when it comes to key messages, Helen is absolutely right. We have to make sure that it is accessible, particularly if it's something where we're wanting support or action from parents and carers. So, for example, in behaviours around COVID, much as we put a lot of time into making materials available in different ways, messages on social media, animations, and simple letters and leaflets for schools, careful attention was also needed to translate where that was a barrier to people being able to access the information. Of course, actually, if it's a more detailed piece of casework with an individual family, it's important that if they need translation facilities, that they are made available to the family as well. And then, I say in terms of the academies, we can set those expectations and communicate how they can work through those things in a way that we would aspire to, but they have to voluntarily take those opportunities up. So it's always by nature work in progress for us.
Okay, thanks, Ian. Councillor Redford Wallace, that is.
Thank you, Claire. Ian,
I can see you. There you go.
in the data slide, in particular, you referred to Black Caribbean, Black African, and then the Asian communities were Indian, Pakistan, the Bangladeshi. Do you have a specific issue between Caribbean and African?
In terms of the data, actually, I think it's so important that it's unpacked at governing body level in schools. They have an insight in terms of the profile of their community, and it comes back to are each of the individuals in the cohort performing up to their potential. If we could get that for every child in the county, we'll be doing phenomenally. But yes, if you then look at county-wide data and if you look at national data, there is no one pattern for all young people from a Black and ethnic minority background. But there are always some concerning patterns. Certainly high outcomes on core subjects with some communities, but a tendency to lower expectations and outcomes for some groups. And traditionally in many areas, Black Caribbean has been a real focus when you unpack that at individual school level. So yeah, quite sensitive. It's not the only one, of course. If you look at some of the other headings in there, cohorts relatively small, but learner outcomes not where they should be if you're considering potential around some of the traveller communities. So yeah, cohort by cohort, there are some real high spots, and there are some where there has to be real care and attention to linking with families and with the community to try and get more engagement and better outcomes.
Okay, no, thank you.
Thanks, Wallace. I've not seen any further hands being raised on this. So if anybody's got any further questions, can they shout out now? If not, we'll move on to the economy and skills presentation. Okay, I'm taking that as everybody's happy to move on. So, Dave, if you can possibly pick up on your presentation, please.
Yes, thank you, Chair. Welcome, everyone. So this little section is going to focus on the wider economy within Warwickshire and some of the data we have on employment and economic activity. I should point out before we move, I mean, because it's such a small cohort actually within the county, we do struggle to get quality data that we can use to really drill into this area in detail. So I'll go through some of the data we have, but I think I have to put a warning against some of the confidence we have in the data on what it's telling us. But I'll talk about some of the national picture as well and how we relate. So go to the next slide, please. So the data we do have shows that the employment rate of ethnic minority groups is good, but it's below the national and below the average for Warwickshire as a whole. So employment rate for ethnic minority communities is just shy of 77%, whereas the rate for all people in Warwickshire is just over 81%. So there's a slightly lower employment rate. And on the flip side, economic inactivity rate is just over 21%, where it's 17% for all people in the county. So we can see some data suggesting that employment rates and unemployment rates are slightly lower and higher, respectively, for ethnic minority and black and ethnic minority groups. But as I say, we do struggle with some of the data because we've got low level of data. Above this, what we can say from national data is that we also know that the BAME community are more likely to be in more less reliable jobs, I would say, so low paid jobs and those with flexible contracts. So we also know that is a concerning area when we look at the wide economic inclusion agenda. They're likely to be on sort of poor quality job contracts and more inflexible work as well. Moving on, I think there was some more data that we have pulled together for employment rates for different groups. Again, it shows a mix, but because of the low numbers, the confidence intervals on those are quite high. So it's probably best not to dwell on them for too long. But I think it sets a slight picture that suggests higher levels of unemployment or lower levels of economic activity. In the wider economy as well, and we don't have this data at a local level, so we can't bring Warwickshire's perspective. But in general terms, nationally, if we look at businesses and entrepreneurship, we see that BAME communities have a lower propensity to start a business and run a business than the national average. So national data suggests, nationally, BAME community makes up about 14% of the population, but BAME communities only account for 5% of businesses in the country. So there is a lower level of that community starting and running their own business. And then within that, we know there are certain instances about challenges around access to finance for that particular group, and they're less likely to raise finance through mainstream sources than the average in the country. So set some sort of context in terms of what we're doing in the county in terms of employment skills and business support. Move on to the next slide. Move on to the next one as well, please. In terms of what we do, in terms of our services, in terms of our business support, our startup support, our employment support, work around apprenticeships and skills development, they're largely in a responsive setting. They're open to all. It's non-discriminatory, and we respond to demand by and large. If an individual wants to start a business, then there's a program. They present themselves and then are supported via programs, and the same with the others. And I suppose the challenge that we set ourselves through this sort of review is that while I'm sure we are strong on equality of opportunity, in fact equal access. I suppose the question is whether we're doing enough on the inclusion agenda, and are we really reaching out to the community and thinking about their specific needs and issues. So like I was saying on business startup, in terms of that issue around raising finance, is that something that we could do more on in a more considered and focused way? So what we're suggesting following this, I think, is to link up with some of the wider research that I know is going to come out of this, and Gordana talked about before about some of the research work around the BAME community, to understand whether or not we could do more to reach into these communities more in terms of promoting startup support programs and fostering a culture of entrepreneurship more in those communities, but also think about careers and apprenticeships and whether there's more we could do to tailor our messaging and think about how we're presenting those opportunities in order to raise aspirations and interest in the opportunities that are available in Warwickshire. So I think we set out what we do and we say we're following on equal opportunities, but I think there's more we could do around being more inclusive in how we go about promoting and engaging with communities in these schemes. And I think that's a challenge that we will take forward and set our teams. I think it's probably all I can say in terms of the data and what we're doing, but very happy to answer any questions that people may have on that.
Thanks, Deb. I'm just taking a look down the list. I've got 2 hands showing, Councillor Core and Councillor Condorcore. So I will take Councillor Core first.
Chair, you got the 2 KKs.
I know. Core and Condorcore. So let's go.
That was a toughie, wasn't it? So just a couple of points I want to pick up, if I may. The first around apprenticeships. I think we do need to do a bit of work around this. This was brought up at one of the staff forums, whereas, you know, we are needing to promote more BAME communities in terms of apprenticeships, looking at, and that's not just within Warwickshire County Council, but that's looking at the whole piece. And the other thing I wanted to just pick up around community engagement really was the work that was done when we went into lockdown round 1, and that was around when we saw outbreaks of rates going higher in certain areas than others, and how I know Public Health, and Les would probably back me up on this, worked with our leaders or community leaders within the different ethnic minority group areas, such as the temples, the mosques, in order to just spread that word about being safe. And I think that's a really important, we talked about language barriers, and I think that's a really important way of connecting with our communities when we know we've got a really vibrant, I nearly said encyclopedia, but directory now around, you know, who our volunteers are, where they are, which community they're based in. And we can really, we've got some really great intelligence there that we can link into areas where we know that there are certain communities who can't speak English, and we can link in with using that. And I think that's a great tool that we've got in our hands there. So I just wanted to pick on those couple of points, Sharon. Thank you.
Thanks, Cam. Keith, your question.
Thank you very much, Chair. Do we have any data on working hours and working unsociable hours, and also related matters of breaches of minimum wage and things? Because obviously the Leicester cases were quite high, and a lot of it was, if we had decent enforcement of labour laws, that may have helped a lot. And obviously working on sociable long hours and some of this sort of sweatshop like stuff that may have been going on in Leicester. So do we have any data on that sort of area in terms of working hours and how many cases we think there are of people working unacceptably long hours, etc.? And do we have sort of feedback from our sort of trading standards? Because obviously getting working conditions better can actually then improve health.
In terms of, and this again comes back to our problem of getting decent data at the local level on this. And so in terms of having data on hours and earnings and zero hour contracts and non-permanent contracts, this is just data that we can't get hold of at a Warwickshire level, so we have to rely on national data. So we could probably pull off some data on those at a national level, but it'd be very hard for us to then apply it locally in that regard. On trading standards, I'd have to take that away and talk to our training standards officers if they have evidence or knowledge of that.
Thanks, Dave. I'm not seeing any other hands up, so if anybody else has got any questions, can they shout? Otherwise, we'll move on to the next item. No, taking that one as a no. Okay, thanks for that then, Dave. The next one. Oh, there we go. So can we have Alison Leakey and Kira Rounsley to present the next item? Thanks.
Thank you very much. Good afternoon, members, and thank you for inviting us to talk on this matter. So my name is Alison Leakey, and I'm the delivery lead for HROD, and today I'm joined by Kira Rounsley. Kira Rounsley is our EDI practitioner and acts as the subject matter expert on equality workforce issues. And Kira is going to talk through some of the detail of this presentation. Our presentation this afternoon clearly is focused on the workforce and our approach at Warwickshire to enable a truly diverse and inclusive workforce, one where we hope that individuals feel they can bring their whole self into work every day. Clearly, the BMA communities are an important subset of that equalities agenda, but our agenda is a broader issue and looks at all of the inclusion areas. I'm pleased to be able to report that members are already actively engaged in this work with us. We have an established relationship with the Staff and Pensions Committee, where we report to them on a regular basis matters relating to equalities, etc. And we also have a regular input with our portfolio lead, Councillor Cancor, to keep her up to date with progress and activity in this important area. In addition to that, our EDI agenda is very much an integral part of the organisation's people strategy, and that document has just recently been refreshed, and we're pleased to say that we're actually going to be sharing that with both Staff and Pensions and the Overview and Scrutiny Committee for Resources and Fire in December. So a further opportunity for members to engage in some of that work. Shortly, I'm going to be handing over to Kira, as I say, who's going to be talking about this in the detail of the presentation. We've got some key areas that we want to focus on. First of all, some of the statistics and data that sort of inform the picture of what our current workforce composition looks like at the moment. The intelligence and feedback that we get from our workforce with regards to what it feels like to work for Warwickshire County Council, and also some of the feedback from focus groups that we've run recently. So she's going to be sharing that information with you. And then the second part of the presentation is looking at how we've actually used that data and that important intelligence to inform our EDI project and our action plan around this area. There's also been some work recently to refresh a number of our EDI networks. And this has been important because we use them also to feed into some of the agenda, but also to make sure that action plan is delivered with both pace and energy. So I'm going to hand you over to Kira now, and she will talk through some of the detail with regards to those information areas.
Thank you, Alison. So if you go to the next slide. So this is some of our intelligence that we've taken from our annual workforce gender and ethnicity pay gap report. So it's quite small on the screen, but the slides will be shared with you after, which you can have a look at it in more detail. But we've got slightly higher representation across the board, across all the ethnic groups. But we do recognise that we have pockets where ethnic diversity is low. So if we take fire and rescue, we know that the ethnic diversity within that specific area needs to improve. However, since the appointment of the Community Engagement Officer, lots of work has been undertaken to increase the diversity of applicants.
And that's included positive action days, engagement with different communities across Warwickshire, and taking part in the wider discussion regarding increasing diversity with external bodies such as neighbouring services, but also the Asian Fire Service Association. So what this tells us is that the proportion of staff who are of Black and Black British ethnicity has increased across all directorates since 2017-18. So within 2017-18, only 1.3% of our workforce was Black and Black British, whereas that has now increased to 2.9% in 2019-20. But we know that not all of our workforce have declared their ethnicity, but our disclosure rate is still really high. So the proportion of employees who have stated their ethnicity has improved year on year. This year it sat at 86.7%. So there's still a small amount of the organisation that we need to encourage and empower to trust us with that data. So when I talk about the EDI project a little bit later on, one of our objectives is around having the infrastructure in place to be able to trust our data and our data to be able to tell us those stories and help us identify issues, etc. And as part of the Data Task and Finish group, we're developing a campaign to try and increase that disclosure rate. We are also in the process of amending the fields in your HR to be more inclusive. So through some of the focus groups that we've done, what data we ask for as part of your HR isn't as inclusive as we would like. And we know if we want people to trust us with that data, that sensitive information, then we need to make sure that the questions that we're asking are right and people know what we're talking about and people feel able to be recognised in the way that we collect that data. So if we just go on to the next slide, please. So this is the first year that we've voluntarily reported our ethnicity pay gap. So gender pay gap is legislation, ethnicity pay gap reporting is not yet legislation, but we wanted to do this because we recognise that actually it's an important step towards ensuring that our workforce is diverse, inclusive and fair for everyone. So we're one of the initial local authorities to be looking at this work. But it has, because it is voluntary at the moment, we don't have a lot of benchmarking information. However, we're making links with other local authorities to see if they're doing any work around this themselves, and it's just not been publicly put out there. So if we look at our ethnicity pay gap, there is a minus 2.6% pay gap between the mean hourly rate for our Black, Asian and minority ethnic employees and those white, British, unknown at the 31st of March 2020. So a negative measure indicates the extent to which our Black, Asian and minority ethnic employees earn on average more per hour than their white, British, unknown counterparts. And then when we're looking at our median hourly rates, there is a minus 3.2% pay gap at the 31st of March 2020. So it's really, really positive that we do have a positive ethnicity pay gap, but we also recognise that Black, Asian and minority ethnic combines and includes a wide range of ethnicities. So actually, as part of the Council's EDI project, we're going to be exploring our ethnicity pay gap data further to break it down a little bit more. And as part of that as well, we're going to be creating a dashboard. At the moment, these figures are taken at the 31st of March every year. But what this dashboard is going to enable us to do is to have that live data and tell a story. We've got lots of different sets of data, and it's about linking those up and layering them on top of each other, so we can be a lot more clear about where we're having positive impacts, where we need to do some more work. Like I said, we do report at Staff and Pensions our annual workforce and gender and ethnicity pay gap report. And this is very much quantitative data. It's very heavy on those stats. But what we want to do moving forward is to tell a story and include those case studies and that qualitative data as well. So if you can move on to the next slide, please. So here's some data that we've taken from the 2019 annual staff survey, which is available to the whole workforce, but also some data from our check-in surveys. So in response to COVID, we've been doing these at different points throughout the year. And then we also ran some small focus groups as well. So how we identified those groups was looking at our 2019 Your City survey data, and we engaged with the service areas who scored poorly on their equality, diversity and inclusion and wellbeing questions. So we recognise that actually this is a very small sample size, and actually the diversity of respondents was limited, thus creating limitations on how representative the results are of the wider Warwickshire County Council workforce. But I'll highlight what some of those questions were in a minute. However, those qualitative feedback methods do tend to involve a smaller sample size by their nature, and do provide an opportunity to dive into areas in more depth than an online survey. Because when we're talking about diversity and inclusion, it also is about how people are thinking and feeling. And we did a SWOT analysis with staff about what they thought our strengths, our weaknesses, our opportunities and threats were as an organisation. As you can see on the slide, the sample size for some ethnic groups is very small, and the observed differences in engagement scores are therefore not significant. But when we look at our response rate for the 2019 survey, for every single ethnicity group, from white, Asian or Asian British, black or black British, the response rate was slightly lower than the representative in the workforce. So for the Check-in 4 survey, we have done a lot of comms to encourage staff to disclose their diversity data, so we can able to cut that data to see if there's any significant difference for different groups within the organisation. But we know that we really need to build trust with our workforce and have that open and honest conversation about why we ask for this data and how we use it. And about that, it's about the bigger picture and showcasing what action we've taken previously. So we've been doing a lot, you said, we did, to show that when we ask for this information, we're really listening and want to take action. So we can just go on to the next slide, please. So on this slide, you might see that for the 2020 positive agreement score from the sample, there's a few not applicables, and that's because these questions are being asked as part of the Check-in 4 survey, which went live at the very beginning of this week. So we're hopefully going to have the outcomes of those end of this year, beginning of January, which we can then share with the wider workforce. So, and then Check-in 5 as well is going to revisit some of these questions, which will give us that data for 2020. But like I said, all of this data was utilised in our approach and development of the Council's EDI project alongside other data sets. So what we found is that people knew that diversity and inclusion was the right thing to do, but wasn't sure on how to embed it in their work. So things like reviewing our equality impact assessment process, creating our diversity and inclusion hub of resources, and having a huge focus on our education and training offer, that data has enabled us to come up with those pieces of work. And as you can see, there wasn't really an understanding of a vision, but as Mark presented at the beginning, we worked with staff to create that EDI vision. So it was really a collaborative approach. So if we just go on to the next slide then, please. So what are we doing then? So our ambitious EDI project is aligned to the building blocks of our people strategy, and we want it to be a clear declaration of our commitment. So we are one of the largest employers within Warwickshire and work with a wide range of organisations to deliver services on our behalf. Therefore, it's really important that we get this right and become leaders in this area. So, like I said, this project is supported by a number of strategies, including our people strategy, but also our council plan 2020 to 2025. And it has a real focus on harnessing the collective knowledge and experience of our communities, our employees and partners through that collaborative working to enable learning and tackle the issues that affect us all. So if we can move on to the next slide. So this is a bit of an outline of what some of our high-level actions are, but just to say that delivery of the project is already underway, and our initial two pieces of work is looking at our education and training and our data. So we are also a member of Inclusive Employers, who are an organisation that work with organisations across the sector on their diversity and inclusion work. And in October last year, we participated in the Inclusive Employers Standard. And in that, we received bronze alongside 70% of other organisations who also took part. So that was a really positive base on which to grow. And we also have evidence of how we can progress the next level and beyond. But more importantly, what that standard has enabled us to measure and further improve the progress we are making towards becoming a more inclusive employer by providing us with a clear indication of both our strengths and areas for improvement from that external view. So one of the key findings from our focus groups was, like I said, that was employees knew EDI was the right thing to do and delivered business benefits, but they were unsure how to embed EDI into their area of work. Therefore, we want to be able to provide a diverse range of education and training opportunities related to diversity and inclusion for employees to access. So actually employees are aware and are able to actively engage in our approach to equality, diversity and inclusion, also understand their responsibilities and actually feel that they can act accordingly with confidence to promote the development of a more inclusive culture. And that will improve our performance overall. So that's going to include reviewing our current offer and developing a refreshed offer for the next financial year. And we'll be doing this through a range of media. I think COVID has made us, think about different ways we can do this. So this might be through a range of webinars, sharing case studies and stories, resources and guides as well. But in relation to data, we want to ensure that we have the infrastructure in place which to provide that accurate data to inform our decision making and measure our progress. So it's really positive that our workforce is generally reflective of the communities we serve, and the evidence is that a diverse organisation is more creative. However, the mistake that organisations can make is believing the job is done once they can see that their organisation is diverse. So for us as an organisation to truly achieve our potential, we really want to strive to foster a culture that's inclusive and not just diverse. Because whilst diversity creates the potential for different opinions and ideas, actually it's that inclusion that allows that potential to be realised. So one of the main parts of one of the most recent bits of work that we're doing is around having conversations about the use of the acronym BAME. So we've been running focus groups, which have been chaired by some of our assistant directors to have conversation with our ethnically diverse staff about the impact of the use of that acronym and what we can do differently. So some of the actions that have come out of those focus groups is that we're going to be doing some more workshops to find correct alternative terms to use in communications. We also want to engage with the community to gather wider viewpoints. We want to produce a guidance document on terminology. And then we need to explore the impacts of data collection. So, for example, why is white always at the top of the list? And how can people self-identify as well? And then we're also going to be doing some engagement with the Senior Leadership Forum. So if we move on to the next slide then. So as part of the membership of our reformed council EDI group, the chair or a representative from our staff networks and directorate employee forums are invited to attend as a critical friend. So that provides the networks with a clear route within Warwickshire County Council to feedback, because we recognise the importance of that two-way communication to enable that collaborative, innovative and accountable environment. So in the past year, we've seen our staff networks grow and become very well established. So we've recently seen the development of our Black, Asian and minority ethnic staff network, and that is already really engaged and coming up with working really closely with to see what we can have as some priorities. So if we go to the next one then, please. So just to note here that diversity and inclusion has been a core component of the council's leadership comms, including the corporate board and strategic directorate briefings. So that's enabling a culture whereby people talk about EDI. We want to kind of change those hearts and minds and bring people along the journey. So as part of Black History Month, we delivered a range of webinars So people might know of Bina Candola, who has done lots of work and has been really highly regarded for their work on race equality. And then we've also worked with the foster carers team to develop training to support foster carers to empower and equip their children and become a lot more culturally competent. So these webinars are being made available for staff to watch in their own time as well. So if they've missed them, they can still access. But we really want to develop and enhance sustainable and inclusive education and training programme of opportunities, because, you know, we shouldn't just be celebrating Black History, you know, when it's Black History Month. So we want to have something accessible for people all year round to start talking about these issues. And then we've got the Warwickshire Children and Families Anti-Racism Strategic Plan. So this is part of John Coleman's area in children and families, and we're working very closely with them to deliver on this, because there's lots of crossover in terms of some of the workforce stuff as well, especially in terms of attraction and recruitment and onboarding and that employee life cycle. So if you go to the next slide then, please. So just to highlight that we commission Equip. So some people might be aware of Equip already, but for those of you who don't know, Equip are our Pan Equality service. So this service works towards the elimination of unlawful discrimination to promote equality of opportunity and good relations between people of different groups under each of the protected characteristics as set out in the Equality Act. So there are some of the outcomes, but some of the work that we've been doing with Quip has been supporting the council to reach those diverse communities in relation to COVID, ensuring that our communications are fit for purpose and meet those hard to reach groups. They also take quarterly equality surveys, which enable us to do some horizon scanning and linking with the relevant service areas and share that data to come up with some solutions. So some of the recent stuff is from protest to positive action in response to the Black Lives Matter movement. You know, we've supported Black Lives Matter, but what can we do now? It's all about turning that conversation and putting it into action. And then we've also been having regular input at the senior leadership forums as well on the diversity and inclusion theme, and that's going to be involving some diagnostic work, action planning, getting in some external speakers and an action learn and focus on that inclusive leadership as well. So that's a kind of our tour of what we're doing in terms of the internal workforce. So I'd like to open it up to any questions.
Thanks, Sarah. I can see a hand from Keith. So that's the only one I can see so far. So Keith, if you'd like to go with your question.
Thank you very much. Very, very good stuff we're doing. One question I would ask, how much does geography play a part? Because obviously a lot of our employees may come from Coventry, which has got a very much more diverse ethnic profile, and also where jobs are advertised, because obviously if a job is advertised in Warwick, you're then looking to recruit places around Warwick, whereas particularly with some of the remote working now, we can advertise far more jobs for Warwickshire. I didn't know how much that actually helped us, how we advertise jobs in terms of where they come from, or where the job is described as being cited. Thank you.
Yes, I think that's a really good point, especially with us working a lot more flexibility now and being able to work from home. Actually, we're able to expand that talent pool we're able to recruit from, because we're not just looking, you know, at local Warwickshire residents like myself. I live in Leicester and work for Warwickshire. So as part of our attraction, we've been looking at our employee value proposition about, you know, selling Warwickshire as a great place to work, and diversity and inclusion has been an important thread throughout all of that. So when we're sharing kind of people's experience of working for Warwickshire County Council, you know, we want to show a diverse range of people working for us, some of the benefits as well, and we kind of what's the word, promote kind of job opportunities across a wide range of different platforms, from like LinkedIn, etc. Sometimes if we want to increase specific diversity within a certain field, we might use platforms like Business in the Community to put out that job as well.
If I may, Chair, can I just ask, in terms of your top level stats, do you break them down into Warwickshire based diversity of employees and non-Warwickshire based? I think that would be an interesting look to see if we're getting our diversity by importing it or whether we're actually supporting our local diversity. Thank you, Chair.
Yeah, I think that's a really good point. And as part of our data task and finish group for the EDI project, that's something I can raise with them and see if we're able to do that through our systems. I'm not too sure how we do it, so I'll have to ask the business intelligence team, see if we're able to do it on postcode, for example. So that's definitely one I'll take back to the group.
Thanks for that. Alison, I have to apologise for pronouncing your surname incorrectly when I introduced you.
That's not a problem at all, not a problem.
And I'm not actually seeing anybody else with a hand raised. So again, if anybody's got any questions and the hands aren't working, can they shout out now? Otherwise, we'll move on. No, I'll take that as a no response. So thank you very much, ladies. I appreciate that. So I'll hand back over to Mark Ryder. Mark, are you there to
Yeah.
Okay, if I can hand over to you, that'd be great. Thanks.
Thank you, Chair. And I know on this is our last slide, and we've really reached the point now where we're thinking about options for next steps. How we're going to use the information that's been shared today in each of the various themes, across the themes, whether it's about our organisation or about some of the services that we deliver and our relationship with communities. And this slide really captures ideas, some things that are in train, ideas about things that we could do so that we can improve our performance and our and the county as being more inclusive and meeting the needs of these diverse communities. So, and I think myself, Rob, and Nigel were just going to say a few words about that, just to maybe stimulate some of the debate. What do you like that's in here, and what other ideas have you got? So I think if we could spend some time with that, Chair, if that's okay with you.
Yeah, that's fine. Yeah.
Okay. So perhaps I'll ask. I don't know who's first up. Maybe Rob. If I can ask Rob to come in, if he's here.
Yep, thanks, Mark, and afternoon, everyone. Yeah, I mean, from my point of view, the equality, diversity, and inclusion agenda isn't just the right thing to do as a public body, as a local authority. It's absolutely fundamental to what we're trying to achieve in terms of performance, being a really high performance organisation, and we see being an inclusive employer, inclusive organisation, and a diverse one as being absolutely fundamental to being an effective local authority. And we want to be really proactive and energetic in taking this agenda forward. And so we've made it very much a central part of the Our People strategy refresh that will be going to staff and pensions next month. And more than anything, it's about the kind of culture being right and the right conversations being there, and making sure that all of our policies and processes match up with the kind of culture and performance that we want. And so you'll see in various places the prominence of this agenda in our recovery plan. And it's peppered throughout the recovery plan, and also the Our People strategy, as I say, which is going to drive forward our internal culture. We're doing a lot of work at the moment in terms of COVID response with Equip and the voluntary and community sector to try and make sure we get our communications to be culturally competent, so that we are able to engage with, as well as communicate with, all of the communities in Warwickshire, so that we understand their needs and we can also influence behaviour. And we've seen a number of examples of that in practice. I think this is the kind of agenda we'll never complete. I think we will always need to be striving to do more and do better. And so I'm sort of interested in whether what I've set out there sounds like the right sort of approach, and also whether, as elected members, that there are things that you've picked up that we've missed. And also whether you feel we're picking up some of the opportunities that maybe are even more prominent now, as Councillor Condacourt said, in terms of ways that we can increase diversity and make ourselves more inclusive as an organisation. and to really drive this through everything that we do. So will it take any questions at all on any of that?
Yeah, I'm not currently seeing any hands. Oh, there you go. So I have Councillor Holland and then Councillor Bell. So Councillor Holland, can we start with you, please?
Yeah, thank you. This has been a really interesting session, and an awful lot of good work has been put before us. Almost everything raises more questions. And in the report we had with the agenda papers, it suggests setting up a working group of councillors, and I think that may be a way forward. It may be that we want this committee or joint committee to continue, but maybe a working group of councillors would be a better idea. And what we need is to take all of the information we've been given and focus down on some specific actions which actually suit Warwickshire and identify the priorities for Warwickshire. We can't just tackle everything, but there are so many different issues. The public health presentation was about a very important project, but on Monday we had a presentation from social services on inequalities in Warwickshire. And there's a sort of mismatch between the priorities from health side and the social services inequalities, and that sort of needs bringing together. And I think that's my feeling, is we've covered a lot of important ground. Everything we've heard has been important, and I'm pleased it was put in. In the report, it does also mention the West Midlands Combined Authority, which I thought was quite an interesting one, because they may have more experience of diversity. And I always think with this combined authority, it's something we pay into, but we don't seem to get anything back. Or perhaps that's a bit harsh, of course we get things back. So my feeling is that we need to say this is the start, so let's pick it up and run with it. And a task and finish group, a smaller group than the whole committee, could then focus on establishing priorities, achievable objectives, smart, simple, measurable, achievable, realistic targets, and then we can take it forward. Thank you.
Thanks, John. Margaret, are you?
Yeah, thanks very much. Yeah, it's sort of linked to what John's just said there. Under your maintaining momentum, you've got OSC's task and finish groups. There was a suggestion from the Adult Social Care and Health OSC that there should be a task and finish group, and indeed 4 of us met yesterday to discuss what it might focus on. But I listened to the presentation on Monday, and this one has been really informative. There is so much going on, and I'm really asking your advice. Is there anything that members in a group such as a TFG could contribute to this? What would be helpful? Because I don't really want to set something up that's just repeating what you're doing. So do you think this would be a good time? What's your advice on member involvement in this?
Okay.
Do you want me to jump in as well, or
Yeah,
are you?
please, Claire. Yeah, I'm happy to follow you.
I think as far from an understanding of TFGs, they have to really add value. And I don't believe a TFG will add value to what is already going on, because I think the priorities have been set and are being dealt with more than adequately. Everything that we've been reported back on today has shown us that. So I'm not sure what a TFG would actually bring. I would personally, and I don't know if this will be backed up by anybody, but personally I would like to reconvene this committee again and have this reported back to us in future. Timeline wise is a bit wobbly at the moment because of the election next year and everything else, but I think we would be better off continuing with a joint committee rather than a TFG or a working group. I think that actually wouldn't bring any benefit, because these things are being handled by people who know much more about these subjects than I do as a councillor. I'm quite happy to admit that. And also, I think that the themes are actually being dealt with on a more granular level through other TFGs that we've got going on for health outcomes and things like that. So it's not just a one size fits all. I think equality, you're right, Rob, equality is never going to be a quick fix. It's going to be an ongoing thing that we always have to focus on, and I think it is being focused on through the other streams that are happening. But that's just my view anyway. So can I bring you in on that, Rob or Mark, just to give a view?
Yeah, I mean, all I was going to add there, I agree with what you said there, and I think there's something about the importance of the dialogue with members about understanding what is going on and being able to contribute through forums like this. The other one that I think is a more concrete action is in the task and finish group activity we have that's informing other agendas, that we actually make sure that this agenda is weaved into that and we don't ignore it, because there, when we're sort of suggesting change and making recommendations, we can actually take actions that are making a direct positive impact. And on Margaret's point, that's where the value add could be. So that was it. I think Nigel wants to come in as well. Thank you.
If I may, Chair, yeah, I mean, I was going to come in anyway and talk about some of these things, but actually I think the questions are really relevant to them. As has been pointed out, and as adult social care and health members will know, there is an agreed task group. Margaret referred to it, and the members have met, but we haven't met with officers as yet because we didn't have the capacity at this time to support it through public health. And that is very much about the health implications and around COVID, and so it's quite a specific and tight group, and I think that's the benefit of that, and we've kind of said that we'll meet in the new year, and I think that is really helpful. I think the agenda itself is so broad that actually it's almost impossible for a task group to narrow it down to a set of urgent priorities, because there are priorities in education, there are priorities in employment, there are priorities in health, there are priorities for the organisation, and then there are other areas we haven't even touched on today, because this is focused on those particular areas. From a health perspective, because I think Mark and Rob talked about the other elements, I think there are two separate issues as well. So the work that's been done around that you've heard about today is very much about a COVID response, and actually about the impact of that on BAME communities, if we're continuing to use that term for the moment. There is also a much wider issue about health inequalities that is not related to COVID, and that will absolutely be a priority of the health and wellbeing strategy, which we're just starting to consult on. And again, there is a lot of member involvement in that, and obviously it has oversight of the Health and Wellbeing Board. So I think that there are kind of a whole range of ways in which this is already being supported. This committee coming back together periodically to kind of just pull some of that together, I think is a helpful way forward as well, to get so we don't lose the bigger picture. The other thing that I did want to mention was our influence as an organisation. As Rob is absolutely right, it's really important that we use our influence. And I know there's a mention of commissioning on there, but we've had a lot of discussion over the last few days and weeks about social value and about the impact of what we do in our contracts, what we expect of those that we buy things from, what we expect of those that contract with. And I think this is a really important part of that agenda, because actually we can spread that influence much more widely than within our own organisation. And linked to that, certainly members of the Health and Wellbeing Board, and I think there are several of you here, will have heard the presentation at the Joint Place Forum around anchor institutions as well. And again, about using the power of the public sector, if you like, with the universities, with Coventry, with the hospitals, etc., jointly to use some of that impact around social value. And again, I think that is a real opportunity for us to say, actually, this is really important to all of us as a series of public sector bodies, and there are things we can do collectively to help address it. So it feels to me there are lots of different opportunities beyond kind of the ones we've been able to share today, really.
Yeah, I agree.
Could I just come back, Chair, please?
Yes, you can. Yeah, Margaret.
So, Nigel, just to clarify, so this OSC that's come out of the Adult Social Care and Health, task and finish group, you think it's worth pursuing then on looking at COVID inequalities as far as health is concerned? Will it add something to the agenda, or is that already being looked at?
It is being looked at, but I think, I mean, we have already said that there are things that we can do with it that might be of interest. So I do think it's worth pursuing. I think the issue is about the capacity for that particular group. Yeah. But what I wouldn't want that group to do is to kind of broaden its horizons to look at a whole range of other stuff that is already being looked at in different ways. I think as we come out of whenever it is that we start to come out into a more normal situation, I think there are things that group can do about looking at how that kind of next few months looks around COVID.
Okay, thanks.
Thanks. So Rob, would you like to come back in? And then I've got hands from Councillor Wallace-Redford, Councillor Core and Councillor Caborn. So Rob, if you can come back in first.
Yeah, thanks, Chair. I mean, just picking up on Nigel's point, I couldn't agree more really about the importance of working with other public sector voluntary business bodies across Warwickshire. Tackling deep-seated inequalities is going to need everybody to play their part. And just a couple of builds on that. One is that we're refreshing the performance measurement framework, and I think getting some really meaningful metrics in there on equality, diversity and inclusion is important, and I think that will help members in terms of scrutiny functions, in terms of overview. And then the final point on scrutiny is obviously we've done the external review, and that's coming to a conclusion, and some of these very cross-cutting themes like equality, diversity and inclusion really need to be woven into all of the standing OSCs and their work programmes in the round, and I think that can then help inform what other bodies, if any, we need on top of that to bring the questions, challenge and perspectives from your constituents that add such a lot of value to what we do, as Mark said earlier on. Thank you, Chair.
Thanks, Rob. Wallace, I'll take you next, please.
Thank you, Claire. Really, just to say that we need to be very careful about task and finish groups. We really do need to ensure that there is value in having a task and finish group, and right at this moment in time, with all the work that our officers are doing. In particular regarding the pandemic, it is a big workload, a very big workload, and I would hesitate to start any task and finish group at this particular time on the issues that we were discussing this afternoon, because it is very wide ranging. I mean, regarding the task and finish group by the Adult Health and Adult Social Care and Health ONS, we are going to review the position at our next meeting for really one very good reason, to make sure, what Nigel has already mentioned, to make sure that task and finish group is not doing anything that somebody else is looking at, because that would be a total waste of members' time and officers' resources. So, I think we need to be very careful. But I do think that as a joint committee, we need to be kept informed, and we need to look at a further meeting. And as you, Chair, have pointed out, unfortunately, we're going to go through a time of re-election, PERDA, etc. We don't know at this moment in time who's going to be in the various posts. We don't even know who's going to be re-elected. So, our next meeting is likely to be, dare I suggest, after the election. So we can move forward by ensuring that our joint committee receives as many briefing notes and updates from the various activities of the officer groups to keep us informed. So I'm not for going down the road of a task and finish group at this time. Thank you, Chair.
Thank you, Wallace. Councillor Cole, would you like to come in?
Thank you, Chair. I just want to say a couple of things, if I may. The first is, may I just take this opportunity to thank all the officers. I think we've had some great slides and some great information given to us today, and also what it's demonstrated is just how much work is being done right across the authority, not just in one particular area, but right across board. The other thing I think that Rob's already picked on, and it was something that I'm keen to see going forward, is around the performance framework and how all these different streams in all the different areas do link into the council plan. So hopefully that will give you, when I say you, councillors, all of us, some sort of assurance that all of these, how can I put it, different areas are linking in where there is connectivity, whereas rather than working in silos, there is a lot of work around equality and diversity that cuts across a whole stream of different areas in the council. And so for me, that's one that I will be keen to look at and work with going forward. And I think that would really give councillors also the assurance as well. Thank you, Chair.
Thanks, Cam. Les, I can see your hand is raised, so if you'd like to comment.
Thank you, Chair. I mean, yeah, I do support that we don't need task and finish group, but I think keeping a joint committee watchful eye is, because I am concerned is, A, we may invent the wheel, but B, how we actually keep track of what is happening around us. For example, I think it's this, the next executive Warwick district has got a new poverty or fuel poverty strategy. Again, it links to this area, and it could be something we look at and steal or borrow and see gets diversified across all our boroughs and districts. What else is happening in our boroughs and districts? And certainly, I mean, I know what is happening in the West Midlands and is happening at Swift. All at this type of work. So I suppose, I don't know, how do we going to keep a track of that? Or do we need some sort of members depository where there's stuff sits that we can refer to and find that we're not reinventing the wheel? It's a huge task because everybody is working on this. And how do we make certain we pick the best ideas from everyone else, add them to what the good work that we're going to do?
Thanks, Les. I can't see any further hands raised for comment. So, oh, I can see something. No, that's just my thing going off. No, so I can't actually see any further hands. If there's anybody else that wants to raise any points before we go on to the recommendations, can you speak now? Otherwise, I can just move on to the recommendations. No, I can't see anything. So based on what we've discussed and the recommendations that have been presented, I'd actually like to put something to the committees, and that would be that the recommendation is, as is in front of us, that the Joint Committee consider the current position and recommend further activity to ensure Warwickshire County Council continues to meet the needs of Black and Asian and minority ethnic communities within Warwickshire. What I would suggest on the recommend further activities portion of that would be that we note the information that's been presented today, and that we agree to reconvene this joint committee at a date yet to be agreed in 2021. Obviously, we've got to take into consideration the, like Wallace said, the elections and the potential change of committee chairs and committee members, etc., etc. So we need to factor that in. But in the meantime, we do receive briefing notes if there's anything new that we should be made aware of through our relevant committees, through the adults and the communities committees. So would the committee that's convened, would everybody be happy with going forward for something along those lines? Or is there anything somebody else would like to add in? I'm not seeing anybody wanting to speak on that. So can I ask that the committee members, if you're agreed that that's the way forward, can you raise your hands just so I can see that everybody's hearing what I'm saying? Yeah, that looks like everybody is happy with that way forward. So I will take that as the recommendation, and that we can all agree that we will agree to reconvene in 2021, and briefing notes shall be distributed as and when required. Okay. So I think that is everything, and we can close the meeting unless anybody else has got anything that they would like to add.
No.
No.
Can we thank you, Chair, for a job well done?
Yeah.